Hello, dear listeners, and welcome to Blush and Bloom, the podcast where we have honest, thoughtful conversations about women's health, self-care, and everything in between. I'm your host, Gigi, and today's episode is one I'm really excited to share. We're diving into a topic that affects all of us, but still doesn't get talked about enough: reproductive health. Joining me today is Dr. Aisha Jaafar Muhammad, a medical doctor with over 6 years of clinical experience in obstetrics and gynecology. She's also the founder of Health Blog, a platform dedicated to improving women's access to accurate, judgment-free health information. In our conversation, we will talk about why she started Health Blog, the cultural and social barriers women face when it comes to reproductive health, and the simple habits that can make a big difference. Dr. Aisha will share tips with us from her wealth of experience. Okay, thank you so much, Doctor, for joining the podcast and for accepting our invitation. Can you please tell us a bit about yourself? Who is Dr. Aisha beyond your work in reproductive health?
I'm really happy and excited to join you on this session. My name is Aisha Jaafar Muhammad. I'm a medical doctor. I've been a doctor for the past 6 to 7 years, and I've been the founder of Health Blog for the past 3 to 4 years. I think we started Health Blog in 2021, early 2021. Beyond my work in reproductive health, I am a wife and a mother to 2 adorable kids. I'm also a daughter, a sister, and during my leisure time, I like reading, cooking, shopping, and traveling. So this is Dr. Aisha in brief.
Thank you so much for sharing. And you have many accolades that I will be sharing in the show notes after the session. So it's really awesome that we can have you on the podcast. So what inspired you to pursue medicine, and what led you to focus on reproductive health, specifically with Health Blog?
For medicine, I think while growing up, that time we don't even know what a gynecologist is or what is even medicine per se, but when I'm asked, I always say I wanted to be. After finishing my secondary school, I think in our society as a woman, we have limited options for career opportunities. Like as a woman, you are expected to maybe be in the teaching career or the health profession, because we were told that we are limited because majority of our community people will say if you are a woman and you study courses outside this teaching or health, either nursing or doctor, any health line, that maybe you won't even be allowed to work, that maybe your husband will not even allow you, or your parents will not even allow you to work.
That's so interesting.
Yes, and that time I had good grades, so we are expected to just automatically apply to the health line and then health profession. So actually I didn't have any objection to that, because I'm really grounded in our culture, in my culture and my religion, so I didn't see that as any issue. I gladly applied to medicine, and then when I started, really, I think it's one of the best decisions that I did for my life. I'm really grateful for that decision, because apart from doing the work, apart from helping people, there is really satisfaction and fulfillment in that. You will see the joy in those women's faces. You will see the happiness. It's something really fulfilling, something really rewarding. You will feel the joy, because unfortunately, majority of our women, even the educated ones, they really do not have much awareness regarding health issues, especially reproductive and sexual issues.
This is true.
Because there are so many cultural issues, especially where I grew up. So many cultural and social issues. So there are so many things that I think there are so many things that maybe I can't even come out openly, and discuss them on an open platform like this.
That makes sense.
But what really made me to start Health Blog, around 2020, I fell seriously sick. that time I was pregnant with my second child, and it got serious that I had to be in ICU after delivery for like 2 weeks, and then after discharge I went to India for surgery. So it was really a trying moment. At that time, I even thought I couldn't be physically fit again to then come back and continue my work, my clinical duties. Because after finishing medicine, after being a doctor, I've always wanted to be a gynecologist. But then gynecology is an area that is really demanding. It's something that really needs your energy, physical energy, mental energy, emotional balance. It's not something that you can go with a chronic illness. I've been with my chronic illness for years, but it was stable until the delivery of my second child. It became so severe that I had to undergo several visits to ICU, several ICU admissions, and then surgery. So at that time, I think I didn't even know that, because seriously, even the doctors here, they discharged me that time and just told me that maybe we should go to India or Dubai or Egypt or somewhere else, because there is nothing much they can do about it. So I thought that I couldn't go back to my normal routine clinical activities. And at that time, I've even registered for my primaries West African College of Gynecologists and National College of Gynecologists for National College of Surgeons for my O&G primary exams. And unfortunately, the exams date, I had to be in the hospital bed. So I thought I couldn't further my journey as a gynecologist. So I said, what can I do with my phone? Since at that time I can press my phone, I can be online. I was always online, always just checking the blogs, Instagram, all these internet online platforms, just to ease away time, to ease away that mental burden of you are a doctor and you are chronically ill, you can't even go to work, all those things. So I just started it. I started little by little, and now I think 4 years down the line, I realized why God made me sick at that time, because at that time I've been questioning myself. Sometimes I will even sit down and question God and say, why me? I thought I was at the peak of my career, trying to start my residency program, all those things, and then suddenly I just couldn't continue. But now I'm really happy that I started health blog. I'm really, really glad, because beyond clinical activities, I've now seen the impact of community, of reaching the individual at community level, of reaching them beyond the clinical worlds, interacting with them, knowing their problems, and then solving these problems beyond the clinical level. I've seen the importance of prevention, the importance of public health awareness, and we've reached over 15,000 women in our monthly online classes, apart from our occasional posts on my Instagram and my TikTok pages, doing monthly or bi-monthly online classes regarding reproductive health conditions. These classes, we take classes on vaginal health, contraceptive health, sexual and intimacy health, pregnancy, breast cancer, and cervical cancer. And I think almost all areas of reproductive health. We've done almost over 20 online WhatsApp programs, online classes over 4 years.
So impressive. And I also agree with you on the aspect of building a community and helping women on the community level, because also at ASALA, we also believe that community is very important, because there are some things that might get overlooked by maybe a healthcare professional who is not as well versed as we might hope. And then it's nice to have like that community you can rely on and ask questions. And learning, I mean, that must have been very difficult for you, where you, as a medical professional, you were going through that whole thing. That must have been very, very difficult.
Yes, it was very difficult. And I think it's really a changing moment in my life. I viewed life differently from how I used to be. Even my relationships, how I carry on with my activities, my spiritual relationship, my entire journey has drastically changed, and I'm really grateful for that moment. I'm really grateful.
That's wonderful to hear that you could take a somewhat negative situation and try to spin it into something optimistic. That's really nice.
Thank you.
I'm going to ask another question that basically you've covered a little bit. So it's about your community with health blog. So from your experiences with working with these women, what are common myths or misconceptions about reproductive health that you've seen that are popular amongst women?
I think we have so many here. Yes, one of the prominent ones, number one, regarding contraception and infertility. They believe that once they've taken any hormonal contraceptive, either pill or injection or implant, any hormonal contraceptive mechanism, they believe that they will have infertility. Yes, they believe that. Yes, they don't really trust contraceptives to infections. They believe that if you have vaginal infections, then you must be promiscuous. Yes, that you cannot have vaginal infection without being sexually active. And we know that there are different types of vaginal infections. There are those that are gotten via sexual activities, and there are those that are gotten via non-sexual activities. So regarding these vaginal infections, because they think that if you open up about infection, maybe people will be perceiving you as being promiscuous, so they suffer in silence. They really don't like opening up. However, with constant awareness, I think now it's becoming less for the infection. Now they are really getting it. And then another misconception is regarding their sexual health, that if they don't reach libido, if they don't reach orgasm, or they have low libido, then it means they have infection. It becomes very serious that the husband will even divorce a wife because she has low libido, she has dryness, and they'll be saying that tana da sanyi in Hausa, meaning the infection is even severe, that she should just go and do treatment for infection. And they believe that their worth is associated with how they can perform in the bedroom, their worth as women. So we really have a lot of issues. And one painful problem that our women face is regarding infertility, that if a woman is having difficulty in conceiving, that it is her problem, that it is from her, that the issue is from her. They believe that a man is always fertile. Our women are being stigmatized daily because of inability to conceive. See, the stigma is not only from the husband, from the in-laws, from the community, and then it will reach to the extent that the man will remarry, and if his second wife conceived, and that will be, I think, for socially, that will be almost like, I wouldn't say a downfall for the first wife, but the stigma will increase. Like it is completely proven that she's the one having the issue, that she doesn't have any worth, that she will be treated as if she is not a complete woman. Maybe she's a half woman, or someone that is not completely, like she's not complete as a woman. So there are a lot of issues regarding reproductive health.
So these are very interesting topics. Thank you for sharing. I do have a question that leans a little bit more on the fertility aspect of what you already mentioned. So now that we know that these things are happening, what are some key things that you wish every woman knew about fertility and family planning, regardless of whether they want kids or they choose not to? Or
regarding fertility, I wish our society will know that issues of trying to conceive is not 100% solely the woman's problem. I think up to 30% the woman's issue, 30% the man's issue, and I think up to 30%. I'm not really very sure. It's combined. The issue is, yes, the problem is both the woman and the husband's problem. And another thing is issues surrounding menstrual irregularities, menstrual problem, hormonal imbalance shouldn't become a problem when you are trying to conceive, because majority of the women will be having issues around their period, but they won't take it serious until they are married and then they are trying to conceive, and then then they will start looking for solution. I wish they will take their menstrual health serious, that they should know when they should seek healthcare professionals advice, when they should go to the hospital, and they should know that if they go to the hospital, because here we have primary health care, we have some private hospitals, we have some smaller hospitals that if a woman approaches a hospital trying to conceive, usually they will say they have irregular period. See, they will not open up completely. They will not go open up and tell the doctor, this is why I come here, I'm trying to conceive. No, she will maybe say she's having discharge or itching. She will be given vague symptoms until the doctor try to ask. And some of them will even go and they will tell the doctor that they are having irregular period or abnormal period, and they won't open up completely. So they won't be given complete fertility workup. They won't be given complete investigations. They won't screen her and the husband. So she will end up spending a lot going from one hospital to the other without getting the results that she wants.
It's interesting because that makes sense, because it's not easy for the doctor to make a good evaluation if they don't have information to work with. Okay, speaking of irregular cycles, I have a question about how the menstrual cycle works, because I think not a lot of women really understand the menstrual cycle.
Yeah.
What's one thing from your experience that you wish more women knew about their cycle?
I think I wish they know about the regular cycle. I wish they know how to calculate their cycle length. I wish they know how to know their ovulation period, to track their ovulation, even if they are not trying to conceive, to know that they are ovulating or not, when the period is regular, and then know when the period is irregular. And then one important issue is that majority of them think menstrual pain is normal. They think it's part of the process. Severe menstrual pain, they think it's normal that during that menstrual period that they have to have that severe menstrual cramps. And some of them even think that if they don't have these menstrual cramps, that maybe they are not fertile enough. And another issue is regarding conditions like endometriosis, like PCOS. We have little awareness, and these conditions affect their menstrual cycle. Like, for example, polycystic ovarian syndrome, it usually presents with irregular cycle, increased cycle length, anovulatory cycles, and other systemic signs. But some of them will even be told that if they are used to having their period twice in a year or 3 times in a year, it is normal for them. Yes, they will be telling them that just the way you used to see your period, that is the normal for you. Some women even see their period twice in a year or once in a year because of this hormonal imbalance, and they thought it's just normal.
I see. I was even going to ask a question specifically about PCOS and endometriosis and fibroids. So I think we're going in the right direction. Thank you. So you've already mentioned painful periods and irregular periods. Are there other symptoms that a woman should look out for, and then they'll be like, okay, this is serious, I should go to the hospital and get it?
Yes, there are other symptoms. For example, for polycystic ovarian syndrome, there is weight gain, there is acne, there is facial hair, and then there are other signs of insulin resistance. For example, darkening of the neck, of the armpits, and then eventually, if it is not treated, she may even have type 2 diabetes, and it will come with all its signs and symptoms of type 2 diabetes. So, and for endometriosis, usually come with severe, painful periods, menstrual cramps. Sometimes endometriosis is very, very difficult to diagnose, very difficult to establish. And sometimes it may mimic other conditions like fibroids and other gynecologic conditions. So these things are usually not, they are not supposed to be taken lightly. There are things that once a woman notices any of these signs or symptoms, that she should immediately go to the hospital. And then I think when they get recurrence of these symptoms after going to maybe a general health practitioner, they should try and book a consultation with a gynecologist. That is what I believe, because we know there are doctors specifically for that area. And I believe the diagnosis will be if she sees a gynecologist than a general doctor, even though a general doctor may diagnose some of these conditions, but I think it's better, especially if there is this recurrent hospital visits, because these women, they usually get tired of even going to the hospital. That is the irony. We tell them go to the hospital, but if they go to they usually get tired, because they'll just be given investigations, and then when they go back, no proper counseling, they won't even know what is wrong with them. They'll be confused, and eventually they'll just get frustrated and just stop going. So that is one of the issues too.
Hopefully, in the long run, it will be easier to diagnose these things, because
Hopefully.
it's so interesting how PCOS could have caused diabetes, and then endometriosis could mimic other conditions. That's
Yes.
be very difficult to detect.
Yeah.
So, moving on to the next question I have for you. Let's talk about women who want to get serious about their reproductive health when they are ready to conceive, when they choose to. So, what steps do you think women should take earlier in life to protect their reproductive well?
I think reproductive health is tied to the health status of a woman, because majority of these conditions, especially hormonal imbalance, is closely related to lifestyle choices. It's not so, even though there are some genetic causes, but greater aspect of it is about, it's a lifestyle condition. So I wish they start to take charge of their overall health, what they eat, the food, their lifestyle choices, exercise. It's really, really it's very important, especially exercise. I know majority of women will be saying they are not fat, they won't go on exercise, or they are not on any weight loss journey, so there is no need to exercise. But exercise usually helps. It lowers inflammation, and this hormonal imbalance is closely linked with inflammation. And PCOS is is one of the conditions that cause hormonal imbalance. So lifestyle modification is very, very important. And then second thing is about sexually transmitted infections, because PID, I think, is the second leading cause of infertility, and sexually transmitted vaginal infections, untreated or poorly treated, are the common causes of PID, pelvic inflammatory disease. So they should, here in our religion, a woman is not supposed to engage in any sexual activity until she is married, ideally. However, we won't know. Sometimes if we tell them to use condom here in it's like we are promoting extramarital life. Yes, because why should even a woman engage in an extramarital activities, you understand, based on our religion? But the painful thing is that they don't know, and they go behind doors and they engage in these activities, and then they carry these sexually transmitted diseases, and then because of stigma, they don't seek care. proper care, and then it leads to complication. It leads to PID, chronic pelvic pain, and other complications. So there are a lot of issues actually. There are a lot of things.
That makes sense. And speaking on religion, from your experience, how do you think religious beliefs can intersect with reproductive health? Like, how can women balance faith with their medical decisions?
Based on our religion, women, we are really protected by our religion. We are protected in the sense that we are honored. If our people are really following the religion, if they are really following it 100%, then I think we will not have issue, because we are being protected. Number one, a woman should be her health, everything should be under her husband, that the husband should take good care of her. If she is sick, he should seek appropriate and prompt treatment. He will feed her, clothe her, and everything. But unfortunately, due to some cultural issues, because cultural beliefs are being interchanged with religious beliefs, because it is usually men's world here in our cultural background. Sometimes, even if it is not a religious issue, a woman cannot even she doesn't have a complete say on her own. Understand, which ideally, based on our region, it's not supposed to be that. Yes, the husband's supposed to guide her, but she also have her rights. She have her rights on the husband, that even if those rights are not fulfilled, that she can go to court and demand divorce. But in our culture, it's seen as like a complete 100% man's world, that she doesn't have her own health choices, that the husband will make complete health choices for her. She cannot go out and seek medical care. The husband will go to the extent that he will threaten for divorce, that if she goes to the hospital, he will divorce her, or he will withhold economic or financial security. He will withhold the treatment, because the husband's supposed to provide anything financially. So if she didn't obey, he will punish her, stop feeding her, or he won't provide any treatment. He won't buy the medications. Sometimes it's not even the husband. Sometimes it is even the mother-in-law, especially for our sisters in the rural communities. Especially for our sisters, there is a lot of illiteracy, poverty, and there is a lot of cultural dominance. So I think we have a lot of issue regarding that one.
I agree. These are very, very, very interesting points. Thank you for sharing those. And I think we are coming towards the close of the podcast, even though I wish that we could go on and talk more about topics. So a question for you. So what's one piece of advice you give women who feel overwhelmed or unsure about managing their health, considering if there's either a case where the woman doesn't have enough access to the right information, or she's being bombarded with several, because I mean, internet now, there are several, sometimes it's not completely verified. So what do you piece of advice that you wish women would know?
I think if she's in doubt, she can always go to the hospital. At least, even if it is a small village clinic, even if it is not a big hospital, those people working there are educated. They have a certain knowledge regarding health and reproductive health. I think they can guide her if she can't have access to the right information online.
That makes sense. So I think this is the final question. Thank you so much, Dr. Aisha, for sharing your insights. So what's next for you and Health Blog, and how do you see the platform evolving in coming years, considering how the information age is going?
Regarding Health Blog, we really want to take it to the next level. We want to reach our sisters in the rural areas, those sisters that don't even have access to mobile phone, those sisters that don't even have access to internet, they don't even know what is any online platform. And I think they need us best, the most. They need us. So we are trying to expand it to reach them, but it's not something that is easy. Actually, it's not something easy, but hopefully in the future, that is where we try to reach, and also try to create like a physical workshops apart from the online activities, physical workshops, physical gathering, and so on.
Okay, and one final question. What's one thing, let's say the person listening to this podcast, what's one thing that you wish for them to take away from our entire conversation, and what's the best way to reach you and follow your content?
I think one important thing is, please, women should take charge of their health. They should know that their health is very important, especially their sexual and reproductive health. And they shouldn't wait until they are sick, or they shouldn't wait until they are pregnant, or until they need it. No, they can start small, little by little, join communities that discuss these sexual and reproductive issues, join communities online. There are so many platforms. They can even research online. There are so many information out there, but they shouldn't wait. They shouldn't wait until they need that thing, because majority of them wait until they are trying to conceive, or they wait until their infection becomes severe before even trying to get information related to that. It's like people are running away from these issues until they do not have any option. So one thing I would like them to know is, please and please, they should take charge of their health. They should go for their routine checkups. Even if they are healthy, they should schedule an appointment, go and see their gynecologist, let them have their routine tests. There are some tests like pap smear that if you reach certain age, or if you are sexually active, that you can do routinely. There are some breast cancer screening methods. There are so many screening methods and investigations out there that are available. Women should please take good care of their.
Thank you so much, Dr. Aisha. Regarding finding you and your content on TikTok and Instagram, I will include that in the descriptions for the podcast, and also share it in the show notes that we're going to create. Thank you so much for sharing your insights.
I really enjoyed it. Thank you so much for having me.
All right. And that brings us to the end of today's conversation. I hope it left you feeling a little more informed, inspired, and connected to your health journey. A big thank you to Dr. Aisha Jaafar Muhammad for joining us and sharing her insights with her rich experience in clinical medicine, obstetrics, gynecology, and as the founder of Health Blog. So you can find more about her work and how to connect with her in the episode description and in the show notes. If you enjoyed this episode, don't forget to subscribe, share it with someone who might benefit from it, and you can follow Blush and Bloom on Instagram using the Asele profile, and also head to www.asele.tech for show notes and more conversations like this. Thank you so much. Take care of yourself and stay curious about your health.